السلام عليكم ورحمة الله وبركاته. In this part I will talking about fungal disease which called mycosis. Previously I mentioned mycosis, disease that caused by fungi, divided into 4 categories. These are cutaneous mycosis, which called also dermatophytosis, and we were talking about tinnias or ringworms as an example of cutaneous mycosis. Second, subcutaneous mycosis. The example of this type, Sporotheric. Third, systemic mycosis. Histoplasmosis and Blasto are an example of systemic mycosis. 4. Opportunistic mycosis, and we were talking about Aspergillosis and Candidiasis as an examples. Let's start with the first type of mycosis, which is cutaneous mycosis or dermatophytosis. Dermatophytosis are cutaneous mycosis caused by fungi called dermatophytes that infect only superficial keratinized structure, which means skin, hair, and nails, not deeper tissue. What is dermatophytes? Dermatophytes are fungal molds that require keratin, protein found in the skin, hair, and nails for growth. Trichophyton, epidermatophyton, and mycosporum are the important dermatophytes causing cutaneous mycosis. How dermatophytes spread? There are 2 ways for dermatophyte spread. First, by direct contact from infected person, and second, spread from animals such as dogs and cats. The examples of these dermatophytes that spread by animals, Mycosporum. This indicates that to prevent reinfection, the animals must be treated also. In this slide, I will talking about tinnias or ringworm as an example of cutaneous mycosis. Tinnias or ringworm is a group of chronic infection of dermatophytosis or cutaneous mycosis, often located in the warm, humid areas of the body. Example, athletes, foot and jock itch. The general name of tinnias on most area of the body is ringworm. But tinnias in a specific location may have distinctive names and symptoms, as we will see in the next slide. Tinnias on most area of the body are generally, as we said, called ringworm because typical lesion, as you see in this figure, have an inflamed circular border containing papules and vessels surrounding a clear area of relatively normal skin. This table shows the different tinnias on a specific area and specific name. So the common name of tinnias located in the body called tinea corporis or tinea corporis ringworm. On the scalp, the tinnias called tinea capitis. On feet, named tinea pedis on athlete's foot. On beard, the common name of tinnias, tinea barbae. Barbae ete. On groin, tinnias named tinea cruris. Jog ete jog. On toenails or fingernails, tinnias called tinea anguina. On Mycoces. This slide shows the epidemiology and treatment of dermatophytes. Dermatophytes, the fungal that cause dermatophytosis, found in the environment and in soil, and are frequently transferred to the skin via contact with other humans and animals. Fungal spores can also spread on hair. Many dermatophytes grow well in moist, dark environments. For example, tinea pedis, which cause athlete's foot infection, commonly spread in public showers, and the causative fungi grow well in the dark, moist confines of sweaty shoes and socks. Second, tinea cruris, jog attach, often spreads in communal living environment and thrive in warm, moist undergarments. Tinea corporis on the body often produce lesions that grow radially and heal toward the center. This causes the formation of a red ring, leading to the misleading name of ringworm. The treatment of dermatophytes. The virus antifungal treatment can be effective against tinnias. Anilamine ointments that include terbinafine are commonly used. Miconazole and clotrimazole are also available for topical treatment. Glyciflovine is used orally. Let's move to talk about second type of mycosis, which is cutaneous mycosis. First, we will define what is cutaneous mycosis. Cutaneous mycosis is a disease that's caused by mycoses that penetrate the epidermis and the dermis to infect deeper tissue. Sporotheric is the most subcutaneous condition in temperate region and commonly known as rose garden disease or rose thorn disease. It is caused by Sporotheric shinkai. Sporotheric shinkai is a dimorphic fungus that lives on vegetation Sporotheric is often contracted after working with soil, plant, or timber, as the fungus can gain entry through a small wound such as a thorn, prick, or splinter. Sporotrichosis can generally be avoided by wearing gloves and protective clothing while gardening and promptly cleaning and disinfecting any wound sustained during outdoor activities. This slide shows you the pathogenesis and treatment of sporotrichosis. Sporotheric infection initially, as you see from this diagram, present as small ulcer in the skin, but the fungus can spread to the lymphatic system and sometime beyond. When the infection spreads, nodules appear, become necrotic, and may ulcerate. As more lymph nodes become affected, abscesses and ulceration may develop over a large area, often on one arm or hand. In severe cases, the infection may spread more widely throughout the body, although this is relatively uncommon. Sporotherics treated with itraconazole, which is generally recommended. In this slide, I am going to talk about systemic mycosis, which is the third type of fungal disease. So, what is systemic mycosis? Systemic mycosis is systemic fungal disease that spread throughout the body. It's also called endemic mycosis because they are endemic, which means localized to certain geographic areas. Infection occurs or result from inhalation of the spores of dimorphic fungi that have their mold forms in the soil. Within the lung, the spores differentiate into yeast or other specialized forms, such as spherules. Most lung infections are asymptomatic and self-limited. However, in some persons, disseminated disease develops, in which the organisms grow in other organs, cause destructive lesion, and may result in death. Infected persons do not communicate these diseases to others. So the question is, why? The example of systemic mycosis are Histoplasmosis and Blasto Mycosis. In this slide, I was talking about histoplasmosis as an example of systemic mycosis. What is histoplasmosis? Histoplasmosis is a systemic mycosis, endemic fungal disease caused by, or the causative agents for this disease is a dimorphic fungus called Histoplasma capsulatum. Histoplasma capsulatum exists as a mold in soil and as a yeast in tissue. Histoplasmosis is linked to exposure to bear and bat. Dropping, especially along the Ohio and Mississippi River Valley in the United States area. Let's move to talk about the symptoms and treatment. The symptoms and treatment. And let's start with symptoms of histoplasmosis. The infection usually occurs as an atypical pneumonia, in the acute form appearing in epidermis with prostration, fever, and respiratory symptoms. Progressive disseminated histoplasmosis, fever, dyspnea, cough, loss of weight, and prostration with hepatosplenomegaly, usually fatal within 6 weeks. Chronic progressive pulmonary histoplasmosis is usually seen in older patients with chronic obstructive pulmonary disease. Disseminated disease, when seen in the immunocompromised, is usually due to reactivation of prior infection, often seen in a human immune deficiency virus infection. Histoplasmosis can be treated with letroconazole, which is used for mild to moderate cases, and amphotericin B, which is used in severe cases or for those who fail of itraconazole. In this slide, I will talking about the second type of systemic mycosis, which is blastomycosis. Blastomycosis is a systemic mycosis endemic fungal disease caused by dimorphic fungus, as you see in this figure, called Blastomyces dermatitis, which exists as a mold in soil and as a yeast in tissue, where this disease frequently caused. This infection usually occurs in main working outdoor in certain areas of South, Central, and Midwestern of United States area and Canada. Let's move to talk about the pathogenesis and treatment of blastomycosis. How this infection occurs? Blastomycosis infection occur mainly via the respiratory tract, and it is usually affect the lung, but can disseminate to the skin, bones, and urogenital tract. The symptoms include cough, fever, dyspnea, and chest pain. It may resolve or progress with bloody, prurient sputum, pleurisy, fever, chills, loss of weight, and prostration. In disseminated form, there are raised vertical skin lesion with an abrupt downward sloping border often seen, The treatment could be occur with itraconazole, which is the drug of choice for most patients, and amphotericin B, which is used in severe cases or for those who fail on itraconazole. Now I'll transfer to talk about the 4 categories of mycosis, which is opportunistic mycosis. I will talk about Aspergillosis and Candidiasis as an example of opportunistic mycosis. Let's start with Aspergillosis. Aspergillosis is an infection that caused by one mold or fungus called Aspergillus. Aspergillus lives in indoor and outdoor. Most people breathe Aspergillus spores every day without getting sick. However, people with weakened immune system or lung disease are at a higher risk of developing health problems due to Aspergillus. The types of health problems caused by Aspergillus include allergic reaction, lung infection, and infection in other organs. There are 2 types of aspergillosis. These are cutaneous aspergillosis and pulmonary aspergillosis. Cutaneous aspergillosis have 2 kinds or 2 classes. Primary cutaneous aspergillosis, which is caused by Aspergillus fumigatus or Aspergillus flavus. The second class is secondary cutaneous aspergillosis. The causative agents of pulmonary aspergillosis or systemic aspergillosis is Aspergillus flavus. Primary cutaneous aspergillosis, in which the infection begins in the skin. It is rare but does occur. Occurs usually at the site of an injury. Also, it is usually reported in patients who have had an injury while working in an agricultural or outdoor environment. Also, it occurs or usually occurs in health care. Often at site of intravenous catheters, vein, puncture wound, or in association with burns, surgical wound, or occlusive dressing. Also, it occurs after candidiasis. Aspergillosis is the second most common hospital acquired fungal infection, and often occurs in immunocompromised patients who are more vulnerable to opportunistic infections. Secondary cutaneous aspergillosis is more common, in which the infection begins in the respiratory system and disseminated systemically. Both primary and secondary cutaneous aspergillosis result in distinctive scars that form at the site of infection. After we are talking about the cutaneous aspergillosis, now we will talk about pulmonary aspergillosis. Pulmonary aspergillosis is an infection of the lung caused by the fungus Aspergillus flavus. A ball of fungus fibers, blood clots, and white blood cells may form in the lungs or sinuses. People may have no symptoms or may cough up blood or have a fever, a chest pain, and difficulty breathing. The treatment with voriconazole preferred for invasive aspergillosis or itraconazole and amphotericin B if itraconazole is not effective. For immunosuppressed individuals or burn patients, medication may be used, and surgical or immunotherapy treatments may be needed. In this slide, I will be talking about the second type or second example of opportunistic mycosis, which called candidiasis. The causative agents of candidiasis is Candida albicans and other yeast in the genus of Candida. Candida species are sometimes responsible for intrigo, a general term for a rash that occurs in a skin fold, or other localized rash on the skin. Candida can also infect the nail, causing them to become yellow and harden. Candida also causes infection in other parts of body besides the skin. These include vaginal yeast infection and oral thrush. The figure shows you some Candida infection in different parts of the body. The treatment of candidiasis could be through susceptible testing for antifungal agents, Cutaneous candidiasis can be treated with topical or systemic azole antifungal medication. Azole such as clotrimazole, iconazole, fluconazole, ketoconazole, and miconazole, nystatin, terbinafine, naphthene also may be used for treatment. Long-term treatment with medication such as itraconazole or ketoconazole may be used for chronic infection. Repeated infection often occur, but this risk can be reduced by carefully following treatment recommendation, avoiding excessive moisture, maintaining good health, practicing good hygiene, and having appropriate clothing, including footwear. To sum up, there are 4 types of mycosis or fungal disease. These are cutaneous mycosis, which is the infection of fungus that occur in the superficial keratinized structure. and subcutaneous mycosis, the fungal disease that infect the dermis and epidermis layers of skin. Systemic mycosis, which is the fungal infection that spread throughout the body, and opportunistic mycosis, which occur after in the immunocompromised patient or after the chronic infection. Each of these types of disease caused by different dimorphic fungi. Some of them are endemic to a specific area around the world, such as Histoplasmosis and Blastomycosis, which is an example of systemic mycosis. Thank you for your listening. If you have any question, please don't hesitate to ask me.